So October is Breast Cancer Awareness Month. Breast cancer is one of the few cancers which is easily curable by early detection. So what do we do for early detection? Self-examination of the breast. It starts from your home. So how to do the self-examination? So every woman above 40 years should do self-examination of the breast on a monthly basis. Like you have to fix a week every month and make sure you do it every month. How to do this? You have to use your right hand for left breast and left hand for right breast, and use your flat of the fingers and roll over the breast and examine your whole breast and notice for any changes like lump or thickening or any nipple discharge. So if you find anything, immediately reach out to your doctor. Also, you should couple this with mammogram screening every year. So if you have family history, then the screening should start early. So for women less than 40 years, ultrasound breast is advisable because mammogram cannot detect small lesions in a dense breast. So young women have dense breast. So if you're going for screening before 40 years, you have to go with ultrasound breast. Above 40 years, you have to go with mammogram screening. So now, if you find anything significant in mammogram, the next step is core biopsy. So this core biopsy is taken by a surgeon and sent to a histopathologist like me. So in this core biopsy, we see whether there is malignancy or not. If malignancy is confirmed in the biopsy, then you have to go for hormone receptor study in the same biopsy. So this hormone receptor study is for targeted therapies. So what is the next step? You have to go for imaging like PET-CT to see whether the disease has spread to other organs or not. After this, the oncologist suggests you what treatment to go with based on the stage of your disease. So there are multiple modalities like surgery, chemotherapy, radiation, etc. So if it is a small lesion and confined to the breast and there is no spread to other organs, then you can go with surgery. So surgery doesn't mean removal of whole breast always. There are options like breast conservation surgery where only the tumor and the surrounding tissue is removed with adequate margins. But if the tumor size is large, then you have to go for removal of whole breast. But in that case, you have options like breast reconstruction surgery, breast implants, etc., which can be done in the same sitting. So you can inquire your doctor about it. Okay, now if the disease has spread to other organs and if your axillary lymph nodes are positive, etc., then it is advisable to go for chemotherapy to begin with, followed by surgery. And this surgical specimen is again sent to the histopathologist, and the oncopathologist looks for any risk factors for recurrence like lymphovascular invasion, perineural invasion, lymph node positivity, extranodal spread, etc. So if these risk factors are there, then you also have to go for radiation post-surgery. So there are multiple modalities, and the oncologist is the best person to advise you what to go with based on the stage of your disease. But there's nothing to panic. If you detect the lesion early by doing self-examination every month and mammogram screening every year, then breast cancer is definitely curable. So let's be aware, detect early and take timely action. Thank you.